Good morning, everybody. We're just getting things started. I'm going to give one more minute as people join, and then we'll get started on the presentation. All right, I think we can get started. Thank you all for joining. Today, we are going to be talking about the U.S. Patient Access Rule and how it impacts the healthcare technology landscape. Just a quick note that links to everything that we talk about are provided for future reference. So don't worry about if you don't catch something, and you don't have to worry about taking notes. Okay. All right, just a bit about us. My name is Mark Hughey. I'm a principal consultant at Arcweb Technologies. And for the Q&A session at the end, we'll also be joined by Cera, who is both the CEO of Arcweb Technologies and someone who has invested a lot of time and effort into understanding the patient access API and healthcare interoperability in general. So thanks for joining us, Chris. All right. The story begins here with the 21st Century Cures Act, which was the last law signed by President Obama in 2016. The law had huge bipartisan majority support and was passed to speed the discovery of cures for killer diseases. Now, the scope of the law is really significant and touches many aspects of healthcare, but the provisions relevant to our discussion today have to do with advancing interoperability and limiting data blocking practices within health IT systems. These provisions and the government's implementation of them provide a heavy emphasis on the patient perspective, giving patients greater control over their healthcare information. So who is impacted by this legislation? So from the payer perspective, basically all government-controlled plans are included: Medicare Advantage, Medicaid, Children's Health Insurance Program, and any qualified health plans on federally facilitated exchanges. Employer plans are not included under the scope of the rule, but some employer-offered health plans like Humana have volunteered to make data available under the provisions of the rule, even though they're not required to. Third-party app developers now have the ability to pull data from payers on behalf of patient users. This takes the existing mechanism of patients utilizing their HIPAA right of access and extends it to a third party so the patient can access their data in a method of their choosing. And there are also specific provisions for family caregivers and caretakers who would need access on behalf of the patient. This is actually a diagram that sort of shows that creation of a third-party introduction into the system, and we're going to show you more information and detail some example apps in the marketplace that are sort of utilizing this framework. So what is happening? We sort of talked about who, now what. In order to increase patient access and control of their healthcare data, the rule mandates that impacted payers provide access to new APIs for third-party apps on behalf of the patient. The Patient Access API provides for claims, value-based encounter data and clinical data. As you can imagine, there are significant challenges related to educating patients, caregivers, and the marketplace on the implications and impacts of this mandate. Another requirement is a provider directory API, which is fairly self-explanatory. Payers must provide access to a list of all providers included in their plans. Next is the formulary API, which provides the preferred drug lists for the plan. This is really the first time this type of data has been available in such a widespread and standardized fashion. One point of note, there is a refresh token. We'll talk a little bit about authentication. So access to this data is granted both through the patient API and the provider APIs are required to provide authentication by the patient, which then provides third-party apps with a minimum 90-day refresh token that can be used to continue to pull data. Payers may choose to extend the token life for longer periods. Humana, for example, has made it 1 year. And the formulary API doesn't require patient authentication. It's just made available. So in addition to the specific API provisions, payers are also required to publish documentation in a developer portal to provide details on the third-party app registration process and patient education requirements. All of this is geared towards providing informed consent by the patient. So let's talk a little bit about when. This is a slide from the CMS website showing the implementation timeline for the interoperability and patient access rules. In the center of the graphic, you can see that January 1st, 2021 was the deadline for the patient access API and provider directory API. In response to the pandemic's impact on the healthcare industry, a 6-month enforcement discretion was exercised, pushing that date out to July of 2021. Now, this slide illustrates the US Core Data for Interoperability data model. US CDI is a standardized set of health data classes and constituent data elements for nationwide interoperable health information exchange, which is required as part of the API criterion mandated by the rule. So all data a payer has needs to be made available in this format. And this gives a glimpse into the types of data that would be available to third-party apps acting on behalf of their patient users. Major pieces of legislation like the Cures Act invariably create significant regulatory and institutional implementation challenges. This situation is no different. The CARIN Alliance is a bipartisan multi-sector collaborative with a number of industry leaders, including Arcweb, working to advance consumer-directed exchange of health information. So CARIN's vision is to rapidly advance the ability for consumers and their authorized caregivers to easily get, use, and share their digital health information when, where, and how they want to achieve their goals. CARIN has been at the forefront of the discussions surrounding the patient access rule in an effort to overcome many of the trust, technical, adoption, and policy barriers at hand. A key component of these barriers is that the underlying regulatory handoff, as a result of this rule, there is a regulatory handoff where you now have personal health information, which is traditionally governed by HIPAA and its provisions for covered entities. And now that data is entering the non-covered entity marketplace where these third-party apps are, which is an environment that's governed by the FTC, Federal Trade Commission. So CARIN has worked to establish a trust framework and code of conduct, open source frameworks for digital identity management, and among other things, implementation guides that Arcweb has led the development of. The first product we developed was the CARIN UX guide. So this is a guide focused on educational content, recommendations, and resources for third-party app developers who intend to implement patient access functionality into their apps. So if you're a third-party developer, your team, product managers, designers, engineering leaders will all benefit from this content. It contains best practices for how to construct the user authentication experience to support informed consent and maintain consistency with the CARIN Code of Conduct. There's even an example app prototype built in Figma, our design tool of choice, which is available as a free resource. This is also something that we contributed to. The CARIN Alliance has assembled an implementation guide to help payers primarily comply with the rules requirements. Although third-party developers may also benefit from the depth of information presented in this document. It's like 50 pages long. The guide details numerous recommendations, all geared towards alleviating burdens of compliance by standardizing approaches to workflows, processes, and educational resources. The recommendations are grouped into these 5 categories. So with regards to the developer portal, I mentioned payers are required to provide the information a third-party developer would need to implement the API. They're required to provide that on a public website. CARIN recommends a portal with access to all business and technical documentation that developers would need to access a payer's endpoints, including the list of those endpoints, obviously, and then technical support contacts, how-to guides, things like that. Sandbox environment. The CARIN Alliance's guide also recommends that payers provide a sandbox environment so that third-party developers can test their implementation in an environment without needing access to HIPAA-protected information. This isn't required, but it is recommended and consistent with other industry standards for API implementations. App registration, which covers best practices for how payers should manage their relationship with third-party app developers, including data collection, data privacy policy, attestation framework, educational resources, security risk considerations, and more. Member experience. So the patient access rule specifics are largely silent on payer member workflow. And so because the policy decisions that are at the discretion through the rule, there are certain provisions and policy decisions that are at the discretion of the payer. And because of those things can have a really big impact on the patient experience, the guide makes a number of recommendations on things like multi-factor authentication, token life, how to orchestrate the ability for a user to revoke access if they decide to do that at a later point. And the last category is service level expectations. So this section includes recommendations for required routine testing and monitoring to ensure proper functioning of their API endpoints. Also, as part of the implementation guide work, Arcweb created an example payer learning center that illustrates a number of the recommendations in the guide. There's also a design prototype available for this as well. It gives a good sort of starting point foundation for for similar efforts. So this is something else we did. This is a demo of the example app that we built to showcase best practices for the OAuth patient authentication flow. It guides a user through login with their insurance provider and provides education about what's being asked of them in regards to access of their information and how data is used. The experience is designed so that an educated user can quickly move past it for a frictionless experience. But if they want to dive deep, they can. And this meets all the member education requirements specified by the rule. So this is a sampling of real apps in the marketplace that are currently using the patient access API. I'll just run through them briefly using their own language, how they refer to themselves. One Record, bringing patients access to their personal health data. Be Well for consumer engagement, holistic health management, and cost containment. Common Health, which is kind of similar to Apple Health. It's for sharing health data, including COVID test and vaccine status. Health Picture gives Medicare subscribers and families a way to track and share health details and medical history. iBlue Button, access your health data from a growing number of Medicare, Medicaid, and CHIP health plans. And MyMeds, personalizing the medication experience through real-time actionable insights. So in the second installment of this webinar series, we're going to do a deep dive into the potential benefits and use cases enabled by the APIs that will power and shape the next evolution of digital health apps. So we'll sort of dig deep on what these apps are doing, what they're using, and then explore some other potential use cases that we see that could certainly be relevant in the healthcare technology landscape. So what does the future hold with regard to this? We certainly see that there will be more of these third-party apps taking advantage of this functionality, finding new ways to deliver value. It is likely that that evolution will be slow in terms of adoption. As this knowledge gets out and the capabilities get out, we'll see more and more on that, and expect that a number of early stage companies will grasp onto the innovation potential here, that the access to this data, that's really the first time that you've been able to access data in this comprehensive and structured way, what kind of value might be delivered to patients in new ways as a result of that. So that is the introduction to a little bit about the patient access rules, where they came from. As I say, in the next series, in the next webinar in the series, we're going to explore all those use cases. Just a little bit about Arcweb Technologies. We're a 10-year-old company. We do strategy, design, and development of custom software. We've been a trusted partner to over 80 companies across various industries, 200 plus projects, all launching new products or introducing new technology that creates business value. So with that, we can move into the Q&A. So if you have any questions, you can drop them into the chat, and we'll go ahead and surface them.
Hey there, Mark. We did have one question during the presentation, which is, what is the typical amount of technical effort to implement the API, either on the app or on the insurer end?
Yeah, good question. one of the biggest challenges with the implementation will be just in regards to the individual effort that would need to be expended for each to integrate with each one of the payers. So as we sort of detailed in the presentation, they have to make those educational requirements known. They will have their sort of own format, although we're hoping they will use the CARIN resources to standardize the presentation of that format. But there will be some individual effort that's required to both do the integration for the first time and then sort of maintain that integration with all the different API endpoints. Any other questions?
I can see one here from Kenneth. It says, any thoughts on how the apps you are helping third parties build relate to the development done with EHR vendors and their app stores?
Oh, I see the window now. Okay. Well, that's a really interesting question because I deal with questions about EHR integration on a fairly regular basis. Off the top of my head, I think that this follows the same model, like in terms of challenges. EHR integration requires a lot of individual implementation effort because of the instance. Each instance of the EHR is implemented at a hospital system client, and that hospital system localized instance requires negotiation with that party to get integrated. I think that one of the other big pieces of value that may come as a result of information being available from these third parties is it may be an alternative to EHR integration, which is typically harder, right? So this now creates an opportunity to get access directly from the payers on behalf of the client, and then using that to make lots of similar insight decisions that normally would require. The approach so far has been, getting that information from the EHR. If we can get it from claims data that's more readily available through these mandated APIs, that would seem to provide an opportunity for a lot more value creation. Great question.
We've got a couple more questions coming in. So from Noeo Kamakani, the question is, what is the strategy for targeting customers, big hospitals, EMR, EHR?
I'm not sure I understand the scope of the question. Chris, if you have any thoughts on this, feel free to jump in. So
context to the targeting, sorry.
Yeah, so well, I guess one of the things to understand is that hospital systems and EHR companies aren't the target of the rule, and which is really focused on government controlled payers, is at least the initial. It's certainly possible that continued regulatory efforts and initiatives will start to target other parties. EHR vendors are under regulatory pressure as it is already. I think, you know, our particular strategy right now is, because these are very early days, we're focused on education, things like this, because we want to continue to spread the word about what is possible, and figure out, you know, new ways to innovate on healthcare technology.
And then we've got one more question here from Jeff, which is any ways to help digital native digital. It says I'm not sure if it's digital naive or digital native. I think digital native patients get access to their records through the framework. Do they need a username and pass for health record, or are there alternative options?
It may actually be naive. I think, yeah, it's, you know, folks that, so this is great from a user experience perspective, you know, a recognition that a certain percentage of the population, and a lot of times folks that have the greatest need for healthcare maybe have significant challenges with regard to navigating digital experiences, you know, on a phone or, you know, other device. So it says, do they need a username and password for the healthcare record, or are there alternative options? So there is a, I maybe glossed over that in the OAuth flow that I showed in the example app. But, you know, essentially a user does need to authenticate with their health plan credentials. So if they, you know, they would need a username and a password for that. There's not currently any alternative that I'm aware of. Chris, I don't know if you know anything on that front, but the idea is that the payer does need to, or the patient does need to provide consent, and there are, you know, patient education requirements regarded in that, so that it's informed consent. But that's a great, you know, sort of point out for one of the implementation challenges here is how do you make that a streamlined user experience that addresses some of those potential friction points.
Just to add a couple things, so you would add your family member as a caregiver with the payer, and then that caregiver will be able to pull the health records from the health plan of the patient on behalf of the patient and go directly to the caregiver. So that means that the caregiver has their own username and password credential and is a registered user with the payer. So this whole system really requires that to be a part of it. There's also been a few questions around EHR integration. So the scope of this discussion has been on the U.S. Patient Access Rule and the parts that impact the payers for the Patient Access API, Formulary API, and the Provider Directory API. So there isn't anything that impacts EHRs directly for a health system, unless potentially they were an integrated health system and they have access to the clinical data.
Great, thanks for that addition. Kurt, did we have any other questions? I think we're at time.
Yeah, we're at time, and that's all of them. I'll just mention, you know, we're gonna do a follow-up to everyone who attended with the links that were discussed in the presentation, and we'll also include our contact email in there, obviously. So if you have any additional questions about this topic, you know, feel free to reach out. We're always more than happy to engage and answer however we can.
Indeed. Thanks everybody for joining. Appreciate it.